Hi, my name is Jessikha. I'm 20 years old and I have an autoimmune disease. That sounds so much like Disney's TTI, the time I sort of intros. Except I'm sick. Today I'm going to talk about what infusions are and some basics regarding treatments and IV lines. Oh, and I should mention, I am currently getting infusions as I talk about it because I thought it would be fitting. Why not? So, let's get started. IV stands for intravenous. It is basically administering medication through the use of a sterile catheter that is inserted to a vein and secured. It's not to be confused with transfusions, which, as far as I know, is only blood that they are putting into a person's body, whereas, like in my case, I am getting blood product. That is derived from plasma, whereas blood is blood. Infusions are used to treat usually serious chronic infections that do not respond to oral antibiotics, but also things such as dehydration. Cancer uses chemotherapy, that's an infusion. Gastrointestinal diseases where possibly, taking medication through the mouth will result in the medication not staying in the body. Crohn's disease and my personal disease, which is called HMG-CoA receptor myositis. So where are IVs typically placed in a body? As far as I know, IV lines are placed in the veins on a person's forearm. So in my case, let's see if we'll do that. You can see where it is placed in my arm. It can also be placed on a hand in a vein. You can kind of see, it's kind of hard. I'm a hard stick, but you can see there's spots where you could get an IV in the arm, as well as in this kind of crook in the elbow. It's called a median vein, and I've also heard it referred to as the quick and dirty spot because it's relatively easy to locate and ideally would not be used for a routine treatment because scar tissue can build up and it can become inaccessible after a while. But that's the case for any vein. If you use it too much, if you poke it too much, if there's too much trauma, physical, whatever trauma on it, it will develop scar tissue and then become inaccessible. Typically, IV lines are placed in a vein that is closer to the surface of the skin. I personally have it into a deeper vein because I'm a harder poke, and they use an ultrasound machine to actually look at my arm and see the vein and guide the catheter and needle into my vein. Ultrasound is actually a really cool technology that allows a person to actually see what they're going for, It allows the nurse to actually see what vein they're going for rather than blindly going in. And it's a really cool technology. So for longer term treatments, you would want to prevent scar tissue building up, and so the least amount of poking that you can do is optimal. The shorter of the long-term treatments is called a PICC line, which stands for peripherally inserted central venous catheter. It's a mouthful. It goes through your arm, so I wore a poofy shirt, which was not helpful. But it goes through your arm, up here on the upper arm, and goes through all the way to a bigger spot, essentially. I'm not the best at explaining it. I've never had a PICC line. I just know that it is a long catheter that goes all the way through a vein, and I'm pretty sure near your heart. I'm not a doctor. I'm sharing the knowledge that I have gained through being a patient as well as researched. And all of my research is down below if you would like to explore that. The PICC line can stay in your arm and body for a semi-long period, typically like 2 to 6 weeks. And it's ideal if, maybe you're in the hospital, you need to be getting infusions on a semi-regular basis, and you don't want to risk the buildup of scar tissue. However, if you have a disease such as cancer, or even the disease that I have, you want to get a port, or a catheter, I think is what it's called. It's placed completely under the skin, and I'm pretty sure it's somewhere up here where they place it, like I think under the collarbone region, to allow access for taking blood as well as administering medication, hydration, treatments, and it can be used for like transfusions as well. Again, it's most commonly used for chemotherapy. That's because it gives access to a large central vein, and you need access to a large central vein for certain medications because it helps dilute the medication and not hurt the body as much. To get a port put in, it requires a minor surgery. It's basically an incision, like a small incision, 1-inch incision in the skin, and it can last for years. But it's not meant for super regular access, meaning daily. Needs to be flushed with blood thinners every month when it's not in use. So in my case, I've actually been receiving infusions for I think about 3 years or over 3 years at this point, and I get it placed every time in my arm because I get it every 5 weeks. Although technically a port would be an ideal situation for me because I don't get infusions daily, and it would mean less of a risk for building up scar tissue. So infusions are typically administered at hospitals. However, you can also receive infusions at an outpatient facility, which is where I'm at currently. I'm at an outpatient infusion facility that is located at my university, although I get my IV placed at hospitals for personal reasons. You can also get infusions at home under the supervision of a specially trained nurse, which can be ideal for some people. It really depends on the medication, the amount of medication you need to take, and how you react to the medication in order to gauge how long infusions take for you. As an example, I have infusions over 2 days, and they take about 3.5 hours each day. So that would be a total of 7 hours over 2 days. As far as I know, we can't go any faster than that, just to keep my body safe in the process. So side effects also really depend heavily on the medication and how you personally react to it. I receive immune globulin, IVIG, which is a pretty well-known medication, pretty well-known IV medication. So the common side effects of IVIG are headaches, cramps, joint and back pain, nausea, dizziness, and chills. I personally tend to get headaches and joint and back pain from infusions, depending on how the day goes for me and how I'm taking care of my body. Your doctor may prescribe pre-meds or medications that you take prior to receiving the infusion to help reduce side effects as well as prevent any extremely adverse reaction. So if you've never taken the medication before and you don't know how you're going to react to it, they probably give you Benadryl, as well as are ready in case you have an allergic reaction to the medication. I take Benadryl every single time because occasionally I have adverse reactions to it, and also it allows me to sleep through the infusions, which gives my body some time to process the medication properly. So this is only a very basic outline of what infusions entail. I intend on making a part 2 to this, multiple parts anyway, to go over kind of what the first time I got infusions was like. It's more of a personal video, more into IV placements including personal experiences as well as hard facts that, relate to everyone, and how to take care of yourself before, during, and after infusions. If you have any questions, leave them in the comments. Let me know if you'd like to see more and what you'd like to see more of. If you like that I am here getting infusions while I make the video, then just let me know and I will try to make more of those. Like this video, it would really help me out, and subscribe if you'd like to support me and see more of my face on your screen. Yeah, I think that's it. As always, I hope you have a good morning, afternoon, night, day, and goodbye.